Welcome to Family Addiction Coaching, a podcast about families supporting a loved one with addiction. Each episode will provide insight into a real family's experience, what families find useful and not, what is available in the community, and what would help make their journey easier. Similar to what happens in our coaching service, we'll discuss how families have encouraged their loved one into recovery, as well as their own family recovery. We'll also discuss harm reduction, an especially useful approach for those with no current interest in recovery. I'm your host, Patrick Doyle of Family Addiction Coaching. With a master's degree in social work, I'm licensed by the state of Massachusetts and comply with the strict code of ethics of the National Association of Social Workers. We are fortunate to have as a guest of Family Addiction Coaching podcast a person who used my coaching services over a several-year period when needing support regarding a loved one's substance use. Mary is a very smart, accomplished, and compassionate person who never gave up and was able to help her loved one find health and recovery from addiction. Mary, welcome to the show, and thank you so much for sharing your lived experience with our audience. Can you give us a brief description of the number of years you dealt with your loved one's substance use and the problems that the substance use led to?
Patrick, thank you for inviting me. I appreciate the opportunity to speak out on this issue as it's near and dear to my heart. Often the needs of families which are torn apart are inadvertently neglected. It would appear in retrospect, and it seems so clear in retrospect, that my daughter began to have difficulty in middle school. She did well in grammar school and did well in middle school all the way up till 7th or 8th grade. And then we started to see a number of changes. She was clever enough to hide what she was doing from us and to make sure that when she left the house to be with friends, that she had a plausible plan and a ride to and from, or would arrange for us to pick her up. We would be up when she arrived home at night, and were in close contact with the young women that she hung around with at the time. But she had already begun to have a secret life and to set up a series of false fronts while she was off engaging in riskier and riskier behavior. Became very clear when she started high school that she was having trouble with her school performance and sports, and that there was something radically wrong. Her behavior escalated over the period of about a year, and we employed all the usual measures. My daughter had a brother 7 years younger. There was always someone home for them. They never went out at night that they weren't driven to and from, that we weren't home when they got home. It became more and more difficult to control my daughter's behavior. Honestly, we were frantic and bewildered, and initially did not have much support from the school. There was someone in the Department of Special Education who was helpful to us and, more importantly, kind to us. But we felt very alone. And back before 2000, people didn't appreciate a diagnosis of addiction. There were not any supports in place in the schools. She was primarily considered a truant child, and we were at loose ends. And I happened to be a healthcare provider, Patrick, and I was reaching out on my own, but knew very little, did not practice pediatric or adolescent healthcare, and knew very little and found very little in the way of supports or programming or literature around this topic. Anya's behavior culminated in her running away one weekend. and it became very clear to us that we could not manage her. It was shocking and devastating and totally humiliating to be at that
Sure.
place. Who would ever have imagined that we couldn't control one teenage child? That was the case.
And she was a minor, of course, when she ran away from
She
home.
was 14. Chose to file a child in need of services, and from that experience received very good support from the court system, stunningly great support from the juvenile court system, about which we knew nothing and had never entered those doors before. And the upshot is that we ended up placing her in a residential setting in Maine. And it was a very restrictive setting where the adolescents were very tightly controlled. And they, in essence, went through counseling and behavior modification therapy during the day, and had their academics during the evening hours. She was there for more than 18 months. It took her a long time initially to begin to take responsibility for her actions. And it was a very long, difficult time for our family. We felt like we were failures. We felt like we should have done something differently, but had no idea what that was. We were spending an exorbitant amount of money, but believed if we did not spend this money, that we would lose her either to a life of crime or worse, or to death, and that this drastic placement was what we needed to do. When that happened, I missed her terribly. I can remember going into a bedroom and just holding her pajamas and sitting on the bed and feeling lost and alone and frightened for her and frightened for us. We also withdrew at that time. That was a big mistake. And if I were to change one thing about how we responded, it would be that today I would encourage all family members to reach out and find some support for themselves.
By withdrawing, you meant socially.
Yes. We isolated ourselves. Yes.
Yeah, you had to keep this to yourselves. You couldn't share it.
I felt like folks didn't understand, and they were very quick to judgment. And the few friends that we did share this with, who happened to be people who were out scouring for her the weekend she ran away along with us, were horrified that we were thinking of sending her to this restrictive school setting. In the absence of anyone being able to provide supports for her while she stayed at home, or effective counseling that she would go to and participate in, or support from the school, we felt we needed to do this. And so we pretty much sent her off to school and then totally isolated.
Pardon me, that was for a long time. I think you mentioned it was for 18 months.
It was for a very long time.
What other choice did you have?
That's exactly how we felt. And we had tried counseling. First of all, to find a pediatric psychiatrist, psychologist, or mental health worker was incredibly difficult 20 years ago.
Yes.
And there were even that small cadre of professionals were made even smaller by what insurance companies would allow or include as providers on their panels. We tried a number of counseling opportunities, and they just weren't effective.
And pardon me, Mary, you're not your typical mother of a daughter in this predicament, in the sense that you're a highly trained medical health professional. You understand healthcare. You've been working in it as your career. You understood about illness and about addiction, I'm sure, much more than another person who was not working in the medical field would have understood. And even with that background and knowledge and networking that you had, you still ran into such difficulties finding appropriate care for your daughter.
That's exactly right, Patrick. There were a dearth of support systems and a dearth of providers, and it was terribly difficult to navigate. And I had been advocating and navigating for patients for a long time.
Right.
Part of it was my lack of knowledge about addiction. Part of it was all of the issues around this being my child who was in such difficult circumstances. And part of it was the lack of services that were available.
Right. Yeah. And I don't know that it's much different today in terms of qualified, effective adolescent specialists, especially around addiction, but also around general mental health issues.
Right. I would concur.
At what point did you and me find ourselves consulting with each other? Do you recall at what point that had started?
I do. My daughter graduated from this program, was accepted to college, went to college directly from this program in a neighboring state. Not long thereafter, was back using, having difficulty in her world. Again, she was at this time admitted to an inpatient treatment facility for a few days. Absolutely not helpful to admit someone for 3 or 4 days and then send them home, in my view, with an addiction.
Right.
And that started a cycle of recovery and relapse. I'm going to say that I sought you out about between 10 and 13 years ago. And I was desperate and did not know where to turn. And again, she was having difficulty. And I reached out to you to see if you could help us sort out what might be helpful to her. To answer your question, we sought out your assistance about 10 to 13 years ago. My daughter was by then living at home. She had not graduated from college. She would have a job, do well for a period of time, relapse, went into treatment 1 or 2 times in acute care setting for 3 or 4 days, followed by a partial hospitalization program. That was totally, it is just not enough
Ineffective.
time to help someone with an acute
Yeah.
addiction. And out of desperation, we called looking for someone who was expert in this area, who may be able to help us find an appropriate setting for her and may just help provide support for our family, because we were frantic and didn't know what to do.
Tell me, Mary, please, what about frantic? What can you describe that feeling of frantic, frustration, whatever it was? What was your emotional experience of that at that time?
You have a child whose life is at risk, and you can't figure out what steps to take to make that better. You can see that this addiction is going to lead them to a life of crime, homelessness, prostitution, or take their life. And you, as an able-bodied adult who's been able to maneuver your way through life, cannot figure out how to impact that and change it. And you keep stabbing at different opportunities because you love this child, and
Right.
and your goal is to make them well and to make them whole. And there really isn't anyone to talk to, and there really aren't support systems built to help you, guide you where to get the support, or to support you in your own needs in the process. And
Right.
it's a feeling of being totally frantic and out of control and unable to assist, and worried to death about this child, and
Right.
worried because this child has a sibling who's watching this unfold.
What I'm hearing is that you must have been experiencing a very high level of fear. You must have been scared out of your mind at times, I imagine.
We were scared and anxious. We weren't sleeping. We weren't eating right. Our families were very concerned about us as well as my
Your
daughter.
health. Yeah.
Our health,
Your
our
health.
mental health. I can remember the job that I was in, one of my siblings would call me 2 days a week. And I would close the door to my office. The phone call probably wouldn't last more than 4 or 5 minutes. And I don't think this sibling called me even once that I didn't cry on the phone. Every single time. That just wasn't how we lived our life. And
Right.
to be that bereft was quite awful.
Yeah. And that went on for a long period of time. It
Very
sounds like
long
maybe
time.
years.
Yes.
Yeah. So it sounds like the impact on the family was tremendous, very stressful, to put it mildly, a source of constant concern, fear, insecurity. So at some point, you and I crossed paths, and we started consulting, coaching, and as I recall, we every once in a while, I'd get a call from you, and you'd fill me in on how things were going. And so I don't know that we had many conversations as much as we had some important conversations at different points along the way. You would reach out and we would touch base, and you'd fill me in on what had happened, and we'd kind of like go back to the drawing board again, come up with a new plan, which you would then implement with your family, and then follow up, see how things were going. And then maybe a few months later, I might hear from you again, or maybe even longer, I might hear from you again. Is that your recollection?
My recollection is after I reached out the first time, you were very kind and gracious in reaching out to us on a regular basis. As someone who is very private in my personal life, it was so hard for me to reach out to anyone. And I would not reach out to you until we were desperate. But you would reach out to me just to ascertain how things were going and, in essence, to show support. And several of those calls, things were okay. And when things were not okay, we would work at putting a plan together.
It sounds like the outreach was critical for you, that if left to your own initiative, it might not have come together as well as it did.
I would agree with that. And that's on me because, as I say,
well, that's every family though, right?
Well, I guess
it's so hard. It's so hard to reach out, and just because one reaches out one time doesn't mean that the next time it might be much easier. I think that's very common for families, that each time they need to reach out, it can still be really tough.
Right.
And that's the impact of addiction on the family. The self-doubt, the questioning, not, the oftentimes shame, and for parents of a person with addiction, it's pretty much universal. What did we do wrong? What should we have done differently? What can we do now? We parents we have unrealistic expectations of ourselves. I experienced your family as such I don't want to say common, because you're not common, because you're very special. You're very unique and loving and healthy. But one thing I would say is that your family impressed me as a great family. You gave everything to your children. you were great parents. You are great parents. So there was nothing that anybody would see as a risk factor for developing addiction. And sometimes addiction just happens amongst families that are loving and close and tight. And that's what happened with yours.
Yes.
Let me ask you about the other sources of professional assistance or self-help mutual support organizations. It sounds like you did try to find those. What was it about my coaching that was different?
Well, for me, Patrick, what made it unique is that I trusted you because you had assisted patients of mine. That is a trust that is hard won. I feel that you have a strong understanding of the problem. You have the depth and perception to see many, many options and put together pieces to try and make a program that works. It doesn't have to be mainstream. You really try to fit it and your conversation and your planning to the family. You always treat both the family and the patient with respect, and yet tell it the way you see it. And I think all of those things are critical for a family to trust, and especially an addict to trust you enough to share and be willing to move forward with a plan.
Having positive experiences, referring patients for coaching, consultation, support, you had very positive experiences which encouraged you to trust me yourself.
Yes.
And let me ask if there was any particular moment, was there a point in time where you felt like this is helping, this is a good thing to do, either I want to keep doing this or I think we're making headway? Was there a particular point in time, or was that something more gradual that just developed over time?
The day that meant the most to me was the day when my daughter came home and said, I need to tell you both, I'm loath to tell you this, but I have relapsed again, and this time is different than the other times. I want to help myself. I've called the insurance company. I need to be admitted inpatient. If you could just advise me where I should go to be medically cleared. I have explored options, and I think I might have a bed in a mental health facility. And I called you, Patrick, and you were able to help me facilitate the admission to the acute care hospital for a medical eval and be the segue between us, the acute care facility, and the mental health facility. And I was holding my breath that we would find a decent placement for her right at that time when she was ready to go, when beds were hard to come by. And I just needed to reach out and lean on someone else and trust that they would help us make it happen. And you did. And that was the moment that stands out to me.
So you still remember that?
With clarity.
And it sounds like that was obviously a time of crisis, but it was also a time of opportunity in that your daughter was coming to you and was open and was motivated, maybe for the first time.
Yes.
As we know, those are critical key points. Sometimes you only get one chance, right?
The key is that the addict has to want their life to be different. They have to want sobriety more than they want to use. And that's a really hard road. You can put all the plans you want in place. If you don't have someone who wants to change, then I don't think change is generally possible. If they want to change and you can be there and put the supports in place, the chance of recovery is oh so much greater. But it is like spitting against the wind if the addict doesn't really choose to want to recover. Either
Right.
way,
And
the family needs support.
absolutely. Because none of us can predict the future. And so we don't know what's going to happen. Up until this point, this had already been a long road for you. For the person with the addiction to come to you after several years of difficulties, and then for the first time say, I need help, I want to make this work. That's a time to take action and to take advantage of that window, because sometimes those windows of opportunity don't last very long.
That's true. And I think you can have addicts that say that more than one time. And unfortunately, I think sometimes families get so burnt that they just can't raise their hopes one more time. And
Right.
I understand that. I appreciate
Yes.
how hard that can be, that you have to make a choice to save the family. But you're right. You have to have a confluence of events that allows you to be there at the time, and then the supports and the money and the healthcare system to help you put those pieces back together for that person.
And the access and a quality program, a quality treatment plan with qualified providers who will give your loved one the best opportunity to gain health and recovery. And that's not easy to find. It's not easy to assess. It can help to have someone that we trust to serve as a guide, because for most consumers, it's virtually impossible to tell. As opposed to, say, if one had cancer or heart disease, U.S. News and World Reports compiles those lists of the best treatment programs for this and that. And so with other medical conditions, it's not as challenging. And our primary care physicians can oftentimes usually recommend a good cardiologist, a good board-certified cardiac specialist. But when it comes to addiction, it's not the same. What is life like now for you, Mary? How would you describe what life is like, what the family is like? I'm so happy upon hearing that your daughter has been in sustained long-term recovery. How would you compare your lives now as opposed to before you started the family addiction coaching?
Let me go back to one point before we move to that, Patrick, which is
Sure.
not only are recovery programs difficult to evaluate, but even if you find a program that appears to be a quality program, you would be quite fortunate to be able to afford one for a loved one, because they are not cheap and they are generally not covered under insurance. That limits who is privileged enough to get those opportunities. And I think that's a key point.
Absolutely.
My daughter has been sober for 8.5 years now. She went through a program. I'll name the program she went through. I think very highly of it, at Plymouth House in New Hampshire. We've met many, many people since that time who have been through that program. Following that, she was at least a year, maybe two, in sober house living in Maine, and found her way back through the program and sober house living. Also not cheap, also
Right.
difficult to evaluate what are quality sober living programs. What do they offer? What does your loved one need? Life is better by far. My daughter is very invested in the sober community. She does quite a bit of speaking on behalf of AA and NA, and is often invited to speak. I've been privileged enough to attend programs where she has spoken, and she does a great job relating to the audience. And I think that it has been a gift for her to be able to offer support to others. And I think it's a gift that benefits her as well by being positive and able to give back. So it's a very positive feedback loop. She lives her sobriety every day. She has changed her outlook on the way she lives, has a good career, good friends, is engaged with the family. I thank the good Lord every single day for that. It is a gift to have her back. It is a gift to have our family whole. We are not without challenges and our ups and downs, but
Right.
overall, I feel very, very blessed.
I've had the pleasure of hearing your daughter speak, and she is charismatic. She is such a gifted public speaker, and she shares her lived experience, the difficulties in the recovery, and she's a compelling speaker. She's a force. I don't know if that's the best word, but she's an impressive young woman who has done so well, and she appreciates and she's so grateful for it, as are you, Mary.
I am. She is appreciative. And I think it's that combination of thank you, Jesus, and let me reach my hand down to pull you up that allows her audience to be engaged with her. And I think her story is a common story, not commonly told, but it's the story of hundreds and thousands of families in this country. And she just happened to be fortunate enough and had enough fortitude and all of the other pieces to come together to support her sobriety. And I think it's incumbent upon all of us, Patrick, to reach out and reach a hand down,
Yes.
share what might work for others, to have any small positive impact on this problem and on families. When families in crisis hear about another family and hear what a choice of supports that may have helped them, and are able to listen to someone who's willing to open themselves up, that can do only good things.
I don't know that you mentioned about the family support that Anya had. One thing that always impressed me was that you never gave up. You just never gave up. You've been to hell and back. It took several years to come back, and you just never gave up. And your strength and tenacity, staying the course and being available to your daughter and not turning your back on her, not kicking her out, never giving up. For me, as a clinician, able to coach you and to see that strength, that was inspirational for me. I use that concept in my coaching work today, and I always will. If there's anything that describes my coaching service, is I never give up. I don't give up hope. Even when I don't have an idea, which does happen, I never give up. I keep working on that problem with the family, with an individual. I'll never give up. We keep working at it until we come to a positive solution. All the time I'm encouraging them that you don't have to give up, and families have to make decisions for themselves. You reinforce that for me, Mary, the way that you just never gave up.
Well, thank you, Patrick. I could never give up on someone I love.
Mary, I just want to thank you so much for your time and for sharing your life journey, your recovery journey. This will be so useful for our audience. You have a great day.
Thank you so much for having me, Patrick. You have a great day as well. Take care.
Thanks for joining us for this episode of Family Addiction Coaching. And if you liked what you heard, please subscribe to the show. We'll continue to interview interesting and strong families as long as there is a need for this information in the community. Make sure to visit our website, www.opioidcoaching.com. If you think you might want professional coaching for yourself or your family, Patrick Doyle is available. Have a peaceful day.